In this video, we will discuss about Glasgow Coma scale. So basically, it is a scale which is used to measure the severity of the head injury. So according to the responses given by the patient. So first of all, just to remember EVM. Okay. Now, this is the electric voting machine. Suppose remember it like this. Now coming on to the first criteria, which is the eye responses. Now in eye responses, if it is spontaneous, or it can be to speech, to pain, and none. Now we give numbers according to the response. So 4, 3, 2, 1. Also remember 4, 5, 6. Okay. Now this is the I response. Then coming on to the V. So the verbal response. Now in the verbal response, it can be oriented, confused, then basically inappropriate words, incomprehensible sounds, and none. So remember the 5, 5, 4, 3, 2, 1. Now coming on to the third criteria, which is M, that is the motor response. All right. So motor response. Now in motor response, first of all is the obeys command, then localizes pain, withdrawal from pain, flexion, extension, and none. So 6, 5, 4, 3, 2, 1. Now always remember, we give the score as 1. The minimum score is 1. Okay. Basically there is no 0 in it. So the maximum score that a person can get is 4 plus 5 plus 6, that is 15, and the minimum a person can get is 3. If the person is having score less than 7, then it means the patient is very critical. Now coming on to the pediatric Glasgow Coma scales. In Paediatric Glasgow Coma scale, in I response, what we see is the either it can be spontaneous, then to shout, then to pain, then none. Similar grading 4, 3, 2, 1. In case of verbal response, what we will see is first of all it will be oriented, then in confused it will be consolable, crying. In first it will be crying, then consolable, crying. Then in this it will be inconsolable and consistently crying, or then in this moaning, then none. Okay. Now in this obeys command, that is the child, he moves intentionally. Similar localizes pain, withdrawal from pain. Now in flexion, you need to remember a keyword, which is the decorticate reflex. And in extension, you must remember decerebrate reflex for the pediatric Glasgow Coma scale. Okay. Now this completes the Glasgow Coma scale. Thanks for watching.